We're joined by Dr.Selepe, Percival, Senior Vice President, Bliss Healthcare. Thank you so very much for joining us.
Thank you.
And Johnston Gichuhi is an actuary with UAP Old Mutual. Thank you very much indeed for joining us.
Thank you.
Yeah, first of all, I want you to hear from you. When you look at the Kenyan health industry, what conclusions do you make?
So primarily, obviously what is at hand is the government's intention to expand the current NHIF offering to now become universal. So not just to those who can afford the 500 shillings that self-employed people are told to contribute, or those who are not employed. My background is insurance, and what I can speak about the state of healthcare is, on the one hand, you have what the government has taken on its shoulders, right, to cover the various illnesses that people go through and the heavy costs that come with that. On the other hand, you have private medical insurance, where, for example, the company that I work for, we provide. So you can come to us, pay a premium, and then we will, cover you, and we tell you which hospital to go to, and and that's that.
Very well.
Yes.
Selepe, you're from South Africa.
Yes.
Which has one of the most advanced health services in Africa. And back in the 60s and 70s, the Kenyan health sector was touted as a model for other African countries. And here we are. It has faced a myriad of challenges. When you look at it, where did we get it wrong?
Yeah, I think the Kenyan health is facing the same challenges like any other country that is facing when it comes to healthcare delivery, where we are all facing the issues of escalating or rising healthcare costs, So, and that makes it more difficult to provide healthcare. And as a developing country, you find that there is more people relying on government or public healthcare, and there is few people who are relying on private healthcare. But when you look at the distribution of resources, there is more resources that are being utilized or pulled into private healthcare to service the minority or few people, whereas now there is a huge number. If you look even in South Africa, we're facing the same. You've got about 67% of the population that relies on public health, whereas there's only about 14%. But if you look at the distribution of resources, so Kenya is also facing the same. And with more people relying on government, that strains the resources that the government is having, and it's difficult really that you can provide a quality health care when you are facing such challenges. And as we all know, that since early as 1948, WHO instituted or advised that there should be this universal health care, which really its intention is to make healthcare accessible to those people who cannot afford, who have got low income or no income at all, and addressing the issues of inequalities when it comes to health.
Yes. I want to find out from you, when you look at South Africa, the way you manage your health industry, whereby the provinces, in Kenya, it will be the equivalent of counties. They play a very big role when it comes to the providence of services, health services, and they work so well with the national government. How comes we are yet to get it right here, almost 7 years since the health services were devolved?
Yeah, if you look at South Africa, the national government mostly is dealing with policy making, whereas the implementation and provision of healthcare lies with the provincial government and partly with the local government. So that's where most of the delivery and in terms of practical implementation of the policies is is done. Yes.
And, since we devolved health services in this country, and this is Gichuhi where you come in, we have seen county government, facing off with medical practitioners, especially doctors and nurses, clamoring for better pays. Who is not getting it right, in your opinion?
Yeah, I think, first of all, the fact that, the Kenyan government has been able to roll out NHIF and have the population access healthcare at quite cheap prices. That is something that is really commendable. I don't think we've seen that in most of the rest of Africa. But there's only so much the government can do, when it comes to burden on tax revenues that we collect. There's only so much we can allocate to healthcare as well as free education. So increasingly, I think we expect to see much more pressure on public healthcare. And that is where we come in and say, as insurance companies, we want to empower people to be able to move away a bit just from relying on the state and the pressures that come around, and be able to access private healthcare. I read an article where apparently 30% of, private hospitals are actually operating at 30% of capacity, whereas, we know public hospitals are quite overstretched. Yes.
And you're talking about, NHIF, and we know for sure that South Africa has rolled out a universal healthcare service whereby all members of the public are supposed to be into that scheme. And we have seen the National Health Insurance Fund, trying to replicate the same here. When you look at the Kenyan market and the policies that we have and the laws and regulations, do you think NHIF has the ability to roll out a universal healthcare service scheme?
I would say it's not an easy task, but it is possible. All it needs, like he has already mentioned, that you need resources. And those resources have to be pulled together and be managed properly in terms of making sure that they are distributed and in terms of making sure that that access to health care is delivered to all, So it's not easy really to come up with universal health care. You can't achieve it overnight. It's a step-by-step approach. I think that's what also in South Africa it was a step-by-step approach. And also probably in Kenya, I can see that step-by-step approach coming in because firstly, like if you tackle the MDGs, the Millennium Development Goals, especially number 4, 5, and 6, which have to deal with health, and you know that you provide those services and you start building on that. Even in South Africa, it's not yet implemented in terms of where everyone contributes to the fund, and that is still going to be implemented in the few years to come. But the milestones are there in terms of how the step-by-step approach that was taken in ensuring that there is an improvement in healthcare service delivery.
I want to hear from you. Yeah. When you look at health insurance penetration in Kenya, it's about 4%.
Yes.
Of the Kenyan population. And when you look at the contribution of health industry to the Kenyan GDP, is about 220 billion Kenya shillings. Yeah. And that's about 2% of our GDP. Are we punching below our capacity?
Completely. So one of the reasons that I think insurance penetration as a whole has been really low as compared to most developing and developed countries is, first of all, attitude towards the risks that we face in our lives. We know that there's a social safety net. It's easy to say, oh no, when I get sick, I'm going to call for a harambe, people are going to contribute, I'll be fine. Or I have an HIF now, it covers kidney failure, dialysis, and cancer, and all that. So that complacency is part of the reason why insurance penetration is so low. Until we get
but
to
also
yeah.
even in insurance companies, I mean, they also share part of the blame in that they have not been as innovative as they should be.
Yes.
And their key focus is always on motor vehicle insurance.
Yeah.
So you cannot escape the blame as well.
No, that's true. Partly, insurance companies have been quite not very adept at adopting, various kinds of either technologies or marketing strategies or products that, excite the public. So partly we are to blame. But
even undercutting in your industry.
That is true. That's a big challenge that we're facing. So, but what I want to sort of concentrate on is, if you have an attitude problem, you have people who, ourselves as well, who comfortably insure a 1 million shilling car without any life or health insurance. That goes to show you what kind of an uphill task we face as insurers. People actually just, want to insure their cars and because these are law that demands you do that.
Legal requirement.
Yes. So until we get to the place where we realize, social safety nets cannot be the answer to everything, we need to take the future in our hands, change the outcome. Let's go into our pockets, save a bit. Let's go to, if it is NHIF or private insurance companies, let's contribute that 1,000, 2,000 shillings a month. Let us, what people actually don't understand is that NHIF and actually most of private medical insurance is quite limited in what they pay out in the event of a critical illness, for example. So if you have 5 million shillings in patient cover, you'd be surprised to know that if you had cancer, you are only covered to about 500,000 shillings. Now that barely scratches the surface of the costs. So it is important that people realize what they have, all right, how inadequate it is, and how they can go to increase the amount of safety net that is possible.
Tell me, please, with more than 20 insurance companies,
Yes.
Offering health insurance and offering these to less than 5% of the population, are we in business, really?
We could be much bigger business. So, for example, I read an article where Kenyans are spending more than 10 billion shillings a year, taking that to India. All right, because that is where healthcare is cheaper and heavily subsidized by the state. So until people realize that Kenya has a capacity, to treat these illnesses, for example, cancer, kidney failure, we don't need to take that money outside. So we have capacity internally, in Kenya. And insurance companies have the muscle, we have the capital, and we just need the critical numbers so that we're able to even roll out our products to even more what we currently don't. So for example, 5 years ago, you couldn't get health insurance if you're over 65. Now you can. It's because more people are signing up, and therefore we have much more data, much more capability to price insurance well.
Yes. I mean, South Africa, has the highest insurance penetration, health insurance penetration rate in Africa, at almost 20%. What lessons do you think Kenyan underwriters would learn from you?
Well, it all has to do with the level of education as well, which, but firstly, what we need to understand is that health care is a fundamental right. Okay, it's not a privilege for people. And in terms of healthcare insurance, yes, in South Africa previously there was a lot of penetration, but as you can see, even there it's sort of going down now as compared to if you were to look 10 years ago.
Yeah, it isn't growing.
It's not growing.
Yeah.
Rather, what is happening is more people now depending on the government to provide the service. So I think in Kenya, at the moment, there is that opportunity that it will grow, but at one stage it will reach a certain level where it's not growing anymore. And but at the same time, I think if I would say what you could learn from South Africa is that also, despite the fact that there is that insurance, but it's not a unlimited cover. It has got limits. And what we have realized is that when those limited benefits are exhausted, now the state has to take over and look after those patients.
Very well. Tell me this. When you look at the Kenyan health industry, I mean, it is divided into three segments. You have the public, you have the private, and faith-based.
Yes.
How comes private institutions have managed to get it somehow right, and they have managed to get into this business, and they are making money, and they have managed to run efficiently? Why is it that the public sector is yet to crack the code?
Well, those are the expertise that are there in private, where, like you've said, people, well, in terms of managerial structures, you have got people who can be able to run efficiently, well, the systems well. Number two is that if you look, the private sector, they are able to recruit skillful people because probably they could even pay them better. Like you've been mentioning that there is a problem of government not paying well. So the skills are not only trained to outside the country, but they are trained into the private healthcare center. There is also technology that is available in terms of the private healthcare sector. And if you look at the private healthcare sector as well, there is that element that they've got well looked after facilities, whereas the government, due to being overstretched and some constraints, they cannot meet those standards. And that tends to affect in terms of the quality of healthcare, you know, that can be delivered between the two. It's not that the government has got the doctors that have got inferior knowledge. In most instances, like where I come from, you find the same doctors that are practicing in private are also employed by the government. You know, they are working full-time for the government and part-time for the private. But patients would still prefer to go to private because of the same issues that I've just mentioned. You know, so that's where also the government probably can partner with private to say, how do we make our managers develop them? We've got companies like his company, they can develop those managers so that you can have efficiently and effectively run healthcare systems on the ground in government. They can be able to work with them to get those technologies, you know. I mean, if you look, for instance, in terms of the government facilities, you know, private healthcare facilities probably in Kenya are more than government healthcare facilities, which makes it easily accessible for the people as well to reach those facilities, and it's difficult for them to access those overcrowded facilities, few facilities that the government has.
Gichuhi, I want to hear from you. When you look at the population growth here in Kenya, every year we are adding 1 million people to the Kenyan population. When you look at the ratio of doctor to patient in this country, is about 1 doctor for 10,000 people, 12 nurses for 10,000 people. Aren't we facing at a crisis?
I mean, yes. So, you know, by the time we get to importing doctors from Cuba, that tells you already where we're headed. So it is extremely important to grow our internal capacity, whether it is, you know, training doctors, whether it is...
But we train them. I mean, every year we are having more than 100 graduate doctors, you know, coming out of our universities.
Yes, but obviously with the growth in population, it is not, in tandem in that line. So not only to train doctors, it is important to know that we cannot rely on the government as well to be the ones to train doctors, because that is what I think 90% of doctors are actually trained and heavily subsidized by the government. So, there's significant brain drain where if doctors first have to work in government hospitals and they find the conditions are not very good, it's easy for them to migrate to other countries. So you can train and then they keep just, leaving your country.
Actually, that is the crux of the matter.
Yeah.
We train so many, but yet they migrate. And they go to South Africa and Botswana and Namibia. How then do we stem this brain drain?
If you already have a problem with working conditions for doctors, these are highly specialized people and this is a skill that you can export anywhere in the world, then you can't expect the situation to improve. And what I have to emphasize is that private-public partnerships, as we've just talked about, are very important. So we cannot just say, big government and universal health care is a solution. We need also to realize that that heavy burden at some point can become unsustainable. It's easy for us to say, NHIF is now covering all sorts of diseases, but at some point that is going to be unsustainable. So private partnership, let's grow our insurance industry. Let's take it on our own hands to go approach companies. Let's go and say, all right, I know that one day I will get sick and health is your wealth. Take it upon your hands. Don't depend on the state. Come to us, come to any insurance company and take your future in your hands.
Tell me this. We have between 7,000 to 10,000 Kenyans traveling abroad, seeking medical attention. And this is draining the Kenyan economy about 7 to 10 billion shillings. And actually some of them, they end up in your country, South Africa. How then do we convince our people and develop quality healthcare services in Kenya in order to stop this?
Well, it's a matter of having those resources available in the country and develop that confidence that the people need within the country. And for me, where I'm sitting or I come from, I see that slowly unfolding within the boundaries of Kenya, At one stage, probably also in South Africa, we used to face the same, Just like the question of, you've just asked, of skills shortage and brain drain. It's not only African countries that are facing that. I've worked in Europe because I was recruited, because of this, they're facing the same problem that they have a shortage. But in terms of healthcare, we must remember that what is key is also preventative, in order so that you do not find that disparity in terms of the skills that you have versus the illnesses that you are facing.
Tell me this, how then do we develop confidence and capacity, in our healthcare system? And when you look at it, and this is a trend here in Africa whereby the rich people, political leaders, and the who is who in the society, when they get ill, they seek medical services abroad.
Is to have resources here. For an example,
is it that we don't have resources or we do not trust our own professionals?
For an example, already in Kenya, you have my organization. They've built a fertility point, which is now going to make it easy for people who have infertility problems to get the service here in Kenya rather than traveling to India. And what has happened, those experts that they are going to see in India, those technologies that they want to access in India, we've brought them here in Kenya, so that people can even save on costs, traveling costs. You don't need to travel anymore. You don't need accommodation costs. The services are here. And this is how each and every developing country needs to happen.
Yeah.
I mean, MRIs are being now used in Kenya. Same. We've got private healthcare organizations that have purchased MRIs, that have purchased pen scans that are available now for the first time in Kenya.
Yeah.
So that is what also the private healthcare is developing, and that it can work with the government so that people can receive these services within Kenya and they don't have to travel abroad to get these services.
Very well. Because we have to wind up, and I want to end up with you, Johnston. Tell me this.
Yes.
If you were to advise the government on how best we can achieve universal health services here in Kenya, what would you say?
It is extremely important for, I think, government officials to realize the resource limitations that we have as a country. So if you're already, heading towards universal free education, and increasingly the government is taking a lot on its shoulders, they need to think outside the box. They need to know that, especially with the population growth, at some point it will become really unsustainable. So again, private public partnerships with expert companies that have done this for a long time, and we're able to manage risks, and we're well regulated, well capitalized. I think, for me, top of my mind, that is the most important step that the government needs to take in its next phase of providing universal health care.
Very well. Gentlemen.